Hello, and welcome to episode 168 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. Today's episode is part of my Back to School series, which features interviews with 9 pharmacists who teach online courses. Up next is Dr. Jimmy Pruitt, founder of Pharmacy and Acute Care University, also known as PACU. Dr. Pruitt is currently an emergency medicine clinical pharmacy specialist at the Medical University of South Carolina in Charleston, South Carolina. During our conversation, we talk about the features of Pharmacy and Acute Care University. Check the show notes for the link to a discount just for my listeners. Thank you, Dr. Pruitt. The show notes are on thepharmacistvoice.com. Just click on the podcast tab and search for episode 168. Thanks again for tuning in. And now, here's my conversation with Dr. Jimmy Pruitt. Hi, Jimmy. Welcome to the Pharmacist Voice podcast. How are you?
I'm doing well. I'm happy to be on, and it's going to be such a amazing episode. Thank you just for inviting me on.
My pleasure. We have never met before, so this is our first time meeting, and I'm excited to hear how you use your voice as an educator in the form of online courses and online teaching. So let's get started.
Absolutely.
Yeah. Can you tell me a little bit about yourself before we talk about your online learning?
Perfect. So just my little brief elevator speech is I am originally from Orlando, Florida. I went to Presbyterian College for undergrad and played football there, and then went to pharmacy school. I then went on to fall in love with emergency medicine and education. So I went my PGY-1 Advent Health Orlando, then went to Grady for PGY2 and EM, and that's when I started figuring out how to use my voice in podcasting and education, and really got me to the point to now where I spend a decent amount of my time creating online content for people.
Awesome. Thank you for sharing all that. We're going to dive into lots of different parts and pieces of all that one at a time. And I guess the first thing that I'm going to say is I know that you have a website that pretty much encompasses a lot of what you do. Would you like to share that website and kind of all the different offerings that you have on the website?
Absolutely. So that's going to be called, this is my newest journey. It's Pharmacy and Acute Care University. I made that website because I would see students, residents, even practitioners that didn't necessarily complete certain training, or if they had a background that didn't allow them to see certain things. I wanted to get everything together so that people can be able to train themselves and have different tools to make it easy for themselves to be able to get research, topic discussion, things of that nature. So that's kind of the overall encompassing reason why and what it does. But it's really just a pharmacy resource to be able to learn, test, and have resources to do things quicker.
Thanks for that overall synopsis. And on this website, I have seen all kinds of really interesting offerings. For example, you definitely have online courses. We'll get to that in a minute. But then also, I saw that you have these pharmacy pearls. And I've checked out your Instagram. There's a lot on there, which is cool. And you have this YouTube channel and you have the podcast. So let's start with those online courses and who are they for? What do people get out of it? And are they ACPE accredited?
Yeah. So again, I call it the PACU. So Pharmacy and Acute Care University, they call it PACU. Within one of the benefits we have is the live webinars, and that's the courses that most people can attend. And what that is for everyone. So we've designed the courses to be, so if you're a student going into your API rotation and it's something in the acute care world, we designed the first part of the presentation to be for you. And then as the presentation goes on, we start to add different chunks and pieces for people who are, residents who are in that practice field, and provide a little bit more data as well. So we've designed the objectives to be all encompassing to get the initial students, and then be able to get the practitioners to go from there. So it's for everyone, and we do this once or twice a month, and these are now ACPE accredited for pharmacy.
Awesome. Now, I understand that you are not the only creator for this content. Can you tell me a little bit about your co creators?
Absolutely. So when I designed this, I really didn't want this to be about Jimmy and what Jimmy knows, because I only know a small portion of the acute care world. So we have now over 30 content creators that work with us, over a variety of platforms, with the live webinars being the more common ones. You see different creators. So I've have creators that work in oncology. I've have creators who work in critical care, internal medicine, spanning all of the acute care subspecialties. And what we do is we ask them, hey, what do you want to be part of? What are you interested in? What gets you going? And we design something for what they want. So all the content is based off things that our content creators are already passionate about. So then we can be able to use the platform to not only promote them, but also provide a different revenue stream for content creators as well. Because again, we want to make an ecosystem that allows people to learn and earn.
That's awesome. And when you talk about co-creators, 30 is a lot. Are all of those pharmacists?
Yep. So all of my content creators are all pharmacists, and they
Wow.
are, again, they have different components. So instead of trying to make it to where you have to do a very large project or a large CE, for those who are not interested in that, we have other components of the website, which we'll talk about later, that they can, again, it's something that may take an hour of your time. It's something that may take, 45 minutes. It just depends on what you have the time and the resources for. And we design our program around the content creator to build whatever they're passionate about and grow from there.
That is an excellent synopsis. And congratulations on pulling together a team that's really passionate about this topic, because nobody speaks to others who are interested in the subject like people who already are doing it.
Absolutely.
So, would you say that you get a variety of people buying your courses, or is it pretty much everybody who's focused on that acute care pharmacy?
I've actually been really surprised by this. I've not only is it a variety of backgrounds, whether it's going to be students, residents, or pharmacists. I've also had physicians who bought into as well into our membership. I've had not, and then to make it even more intriguing, we have pharmacists and healthcare professionals from other countries. We have a variety of our population from Australia. We have some from Saudi Arabia and India. So I've been very intrigued by the variety of people from a specialty standpoint, but also just from what their profession is and the location of their practice.
That's pretty cool. How do people even hear about this? Because, I didn't know about this until I heard about you and your podcast. And then I took a deep dive and I started this back to school series. And here we are.
I think one of the biggest thing is I like everyone talks about a funnel for what they have, and my podcast is where I think most people learn about myself and my platforms, and then social media as well. And I think anyone who's get in this space and you're a content creator yourself, it has to be a certain level of resources you put to attracting new members. And I was fortunate to have the largest emergency medicine pharmacy conference in March. We had a speaker from Australia, and they came and spoke at that conference. And one of my content creators is from Saudi Arabia. So again, our content creators are is the focus for us. We build around them, and then they can bring in people around because again, their people want to see their work as well.
Very cool. Yeah, it's almost like networking in certain ways.
Yeah,
The
absolutely.
podcast is a way to network, because it's a very intimate connection with that single listener. And then meeting people at conferences, of course, that's how ideas spread too. Very cool. Well, back to the website. I want to tell you what my favorite thing to look at on there was. And I don't think I had access to these, but patient
Yeah.
scenarios. I definitely want to talk about that because whenever I go to a CE live and somebody says, LW has hypertension and they take these drugs, and what are we going to start? What are we going to stop? One of those scenarios. Oh, I'm listening because I'm problem solving. So tell me a little bit about the patient scenarios that are on your website.
Absolutely. That was one of the things that was actually recommended by our members. They wanted a little more, and they wanted to figure out what's a way for me to test myself, because depending on the stage of where you're at in your practice, sometimes you know the information, but can you test yourself? And that was a way to engage some of our more advanced practitioners. And we wanted to make sure, and in some of our colleagues who are content creating, they do really well at just writing the questions. They don't want long form. So just for them to make the question, that was another way to get our content creator community more active. So what we do is every specialty, and what we do is we go through the HHP competencies for PGY2 programs. So for emergency medicine, critical care, internal medicine, and we take those those required topic discussions, and we build questions around those. So not only are you getting what you need from just a standard standpoint, we're trying to mirror what you have to learn from a PGY2 and PGY1 competency standpoint anyway. So I think what we're going to do is build this entire ecosystem to where you can learn information and then turn around and ask yourself 10, 15, 20 questions on that type of content.
Now, are those patient scenarios free to access, or is that content that the user needs to pay for?
Yeah, so that's going to be all within our membership. And usually, what we do is we have some of our landing pages, we have samples of these things. So, with our platform as well, you can have a few questions that way, or you can just trial the entire website and the entire membership for 7 days and see if it's for you. And during that time, you have access to the entire platform. Right now, I think we're sitting close to like 90 courses. We'll be over 100 by the end of the month. So, again, we'll have a
Wow.
ton of content that you can have access to. So for those who are just intrigued with just that component, is it worthwhile for everything that we do? You can just check that out and see, and then figure out what it may be something else you're interested in.
I think you've thought this out extremely well. Do you even have any competitors that are competing for attention in this space, like online learners?
I think one of the biggest things, unfortunately, my big competitors are the major organizations. So AHHP, ACCP, they all have certain platforms that encompass one piece of this. Again, where we strive to really get to the customer and to the consumer is that we have all of these things in one. And from a price point standpoint, we are in a very favorable position as well. So we try to make sure that, again, we don't have someone who's doing the exact same thing, but we have some different competitors who have a certain portion of these things.
I can only imagine how quick and agile you are because those major organizations have boards and, members and departments and you are Jimmy with 30 other people. So, can you talk about a little bit about how fast you're able to pivot and create new content and post things compared to those larger organizations?
That's one of the beauties of this. I have 30 content creators, but again, from a administration standpoint, it's just me. So I think the best thing is that being able to ask my members, hey, what do you like? Because I want to make my platform based off what my members, my content creators enjoy, because it's our ecosystem. So I got feedback in January that people wanted questions. I had questions up by February.
Awesome. That's fast.
So it's being able to pivot and move, because again, I don't think I have the perfect platform. I want to continue to utilize feedback and mold the platform into something that should be much different in a couple of years from now. But that's the beauty of not being part of a huge organization, being part of so many checks and balances in play. I can just play off what I feel, what I see in practice, what I feel in my community, and those are the things that help from a pivoting standpoint. That's the beauty of being small. That's every business owner who's small. You enjoy the control. You enjoy the creativity. You enjoy being able to be very intimate with your community.
Listening to your customers is so important. Giving them what they want will keep them coming back. I love that you talked about that. So, congratulations on just being a really good vendor. You can't be a successful business person unless you listen to your clients, and you're doing it. That's great. Well, I kind of directed the conversation so far, but what else would you like to share about being an online educator and what you offer?
I think this the when speaking of being an online educator, I think one of the key things I like to talk about and remind myself, because it becomes so challenging because it never stops. You have to continue to be consistent, and consistency is a big word. And if
Mhm.
I talk to talk to people who follow me and talk to my community members, the big thing I try to provide is consistency. With over 100 courses in the span of 8 months, that's something that you have to have a certain level of consistency. And again, the biggest thing that keeps me going is that I don't want to make all this about me. I've achieved a certain level of success that I'm happy with. What I get to do at the bedside, I'm so blessed to do. And I just want to provide people with the feeling of when I have a patient that's very sick, and I'm just fortunate to do this every few weeks. I have a patient that's very sick. My providers ask me what to do. I physically get to go and do that thing, and a patient goes from potentially being declared dead to being alive. That feeling of helping a patient with my team get back to a good baseline and seeing them walk out of a hospital and my team saying, hey, because of the recommendations you made, because of you being quick with this, because of the communication that we had during that intense moment, this patient get to go home with their family. And when that happens, that feeling is just amazing. So everything else is just icing on the cake. And when you're creating content, I just want other people to feel it doesn't have to be a life or death situation, but the feeling I get of appreciation and satisfaction, I want that for everyone. And what I believe through the content that I'm creating is that people can get small pieces of the confidence that's needed to make those recommendations or to be in position to have that certain level of communication to feel completely satisfied with what they're doing. So I think that's one big thing is being consistent. But for me, my why is that feeling that you get. And I want everyone to have that feeling every day when they go in to do whatever they do.
I love your confidence, but I also love your level of competence. You are certainly competent at your job, and you know that feeling that, hey, I've helped somebody. And I love that you want to create that feeling in others. And I love that you understand what they need because they've told you, but also because you've experienced it yourself, going from novice to expert. You don't become an expert unless you're in situations and unless you're what is it? Your hands are held to the fire a few times.
Absolutely.
And then you build that competence, you become that expert. So that's pretty cool. And I love the pure place you're coming from where you're just trying to be the guide with the plan and transform people, other people from novice to expert.
Absolutely. And the big thing is that I don't have the platform is there, but I think ultimately if I can talk to people and say, I'm not selling a course or a question. It's an experience that you get to have at the bedside with your team. And that's amazing because I've had people write back and say, hey, you just released this, you reviewed a study, and I have to go to a meeting tomorrow, and now I don't have to review that study anymore because I've heard it and I was able to listen to it at an 8-minute video on my way to work. Or I have students and residents who say, I had a topic discussion and I didn't know where to start, but the reference library had everything together. It had podcasts, it had blogs, it had the guidelines all in one form for me to be able to view. And that's saved me time. I can spend time with my dog. So it's all the other things that you get with the program versus the actual information that comes every day. That's the big thing for me.
Dr. Jimmy Pruitt helping people spend more time with their dogs. I love it. But you bring up a good point. You have content in forms other than written print. A lot of people don't have time after staring at a computer or just doing their job for 8 to 12 hours to come home and sit and read more. Not that everybody sits, but I mean, if anybody stops moving for a second after 12 hours of work, they're going to want to sleep. So if they do need to walk their dog or do their dishes or take out the trash or, you get the picture, they can listen to a podcast or a video communication of whatever the content is. And I think that's a really good selling point. Going back to your reference library, would you like to explain some of the other features of that?
Absolutely. So what we have now in something that I remember going through residency was challenging is you spend so much time trying to find the information that you don't have enough time to consume the information. And
Mhm.
I thought to myself, even as a preceptor, you have to find articles for your learners to read. So, what would be a way for me to kind of have all this in one location? So, when I say cardiac arrest, what should I read? What should I have my learners read? Okay, I have something quick for you to read, but I also have it to where we have a guideline, a few primary literature articles, and then a podcast or a blog. Because in the acute care space, we're getting into doing a lot more in the blog space now, and it's easier to consume that information. So, if I can give you a way from a quick review standpoint to look at that, that's what I have for now. We're sitting close to 20 or 30 different courses just on that. So depending on the disease state, we will have that information. Again, this is not based off what Jimmy thinks popular. It's based off what ASHP has deemed for their emergency medicine, critical care, and internal medicine residents need are required actually to have information on. So that's the big thing. So I have the quick review where it's just a few things that you can use if you have a few days to look at something for a smaller topic. And then we have the rabbit hole, which I love because everyone gets on rabbit holes every once in a while. And what this is for those people who want to dive a little deeper into create a research project, who have a seminar coming up, and you don't want to spend all of your time searching for information. We have that information now for you. Whether we have one course, I believe we have probably in the rabbit hole section alone, there's probably, I think, 60 references. So and it's broken down by the intervention. So for example, for cardiac arrest, each medication that we use in cardiac arrest, it has its own section within the rabbit hole. So you can see just about epinephrine. Everyone knows, give epi in cardiac arrest. But what does the data say for that? Okay, we have probably 10 or 15 links to the primary literature on that particular intervention. And we break it down into book chapters and review articles. And then again, we still have a comprehensive list of blogs and podcasts that talk about that unique thing. So we try to make it to where again, that's the time saver. And it's something that I think is unique because I haven't seen that on the market yet. I think that's a tool that can be utilized by, again, students, residents, and preceptors who actually know the information, but they don't have time to organize that and put it in one location. So again, that's the unique of it. You have the quick review that has probably four to five pieces of content, and then you have the rabbit hole that can, again, it can get pretty deep in there.
I love the relatable phrases that you use. Relatable phrases such as the rabbit hole section. And I have no doubt that if I were one of your subscribers to your content, I would go on that reference section and it would probably say the rabbit hole section, right? Am I right?
Yep, it does.
That's awesome. No, but that's so relatable though. Nowadays, people use that phrase all the time to describe this is a deep dive or this is going down the rabbit hole. I love that you call that whole section the reference library because when you talk about pharmacists needing information and you have basically curated it for them, you've brought the best of the best right in front of them and you've given them basically the links, the lists. You are basically giving them the references. And it's like as advertised, everybody needs that.
Absolutely.
Yeah, I just love how relatable what you talk about and how you label stuff. It's just quick and easy. I went on I guess you call it the PACU website or pharmacy-acutecareuniversity.com. And I found these 6 sections, the masterclass, the reference library, the community forum, the live seminars, the literature review, the patient scenarios. It's just all like really quick and easy to find what you need. And I just want to give you a lot of kudos for making something that's so user friendly.
Absolutely. I think I love our community within pharmacists, but the one thing that I noticed that was challenging for me when I was in school and residency is we tend to make things pretty challenging or make things very hard. My physician colleagues love to pick on pharmacists and they say, you guys just think too much into all these things. Just say what it is. And I noticed there's a small bit of truth to that. Sometimes we can be very comprehensive where some people want simplicity. And for me, I don't claim to be the most educated or the smartest person in the world, but I try to be the most useful. And that's what I want my platforms to represent, something that's useful and something that everyone can take their piece of and say, I need this one part of this, or I need this other part. And at the end of the day, I can get some CE credit for it as well.
Yeah, and it's easy to navigate. So yeah, I think you're doing it right, Jimmy. You're doing it right. I appreciate it. And that's why I really wanted to talk to you today. You've got so many great opportunities for pharmacists to learn, but then it's also what I call curated. And I heard that word from Dr. Kelly Carlstrom. And she's actually the one who recommended I talk to you in the first place and started listening to the podcast. And I went down a rabbit hole, and here we are. But anyways, she talks about curating information. That's what you've done. And I just love how relatable and simplistic it is to navigate. It's what every pharmacist really needs. As a consumer, we need to be kind to ourselves and we need to be kind to the people that we communicate with. So Let's all keep it simple, people.
Yeah,
I love
absolutely.
it.
Absolutely.
Yeah. Well, would you like to talk about any of the other features like the master class, anything from the live seminars? The floor is yours, sir.
Perfect. So again, I'll just briefly mention a few of these things. The master classes is what we're constantly tweaking this for our members, because if you don't necessarily want to watch a video live, or if you want something that's a little bit more wordy on the screen, now we've taken PowerPoints, we've taken content, and we've made it to where we now have an entire section dedicated just to that material. This week's that we were releasing is a C. difficile treatment. And instead of you just going through a PowerPoint and clicking through, you have everything on one page. You scroll down, you see what you need. We have different images and graphs that we've actually made ourselves and redesigned, so where you can have more original content and images. And then from there, you go through all of that and you say, okay, I need a little bit more. Anything that's related to a masterclass, instead of us doing a ton of references at the end, we can take you to the reference library for that particular related content. Or if we have a podcast that we've released in the past on similar content, we push you to that as well. So that way you can really master that topic in a variety of different platforms. So the masterclass is something we're continuing to tweak and work with, because again, we take PowerPoints, we take all this different content and try to make it more original for the user. And we're still just messing around to see the best way for that. But again, ultimately, you have a presentation. I like to think of it as a book chapter on a particular topic, and you go from there. And we have tons of, again, the best thing, our first one we did, we had tons of videos and people talk about different aspects of the intubation process. And we had physicians talk about their component. We had nurses talk about their component. It just really just trying
Interesting.
to get a holistic view of this and make it, again, we're a pharmacy and acute care university. So we're not holding out other members. Again, anyone that's in acute care can benefit, and those are people that we are having create content as well. So it's something that's really unique from the masterclass standpoint.
Yeah, I like how you cross reference everything. And I also love that you have learners that are not just pharmacists, because just like we listen to physicians when they're teaching us things, physicians can learn how we see it through our lens too, or nurses, etc. That's pretty clever.
Absolutely. I guess the last big thing that we have is I think the what most people are consumers of is the live webinars, and those are the one again that are now approved for ACPE pharmacy continuing education. The big thing with those is that we don't want to limit the content just to our members initially. This is one of the things that we actually have open for everyone. So if you want to watch one of our webinars that we're doing again once or twice a month, you can come in, watch it, and see if you enjoy the content. And we have experts from all over. We've had a physician from Seattle speak. We had people from all over either be part of making the content or actually there doing the live session. And it's been really unique to see the different topics that people recommend, because again, this is built by our community. If you guys, I had a person email me, say, hey Jimmy, I want something from a toxicology standpoint on calcium channel blockers. We did that in March. Was able to get an expert that did ED and critical care that actually took care of these patients, and was able to create that content. So now we're moving forward, and we can have anyone get on a Zoom call. We want to make sure if there's questions, we're using different technology for you can answer questions live when you're there, interact with our speakers. And it's really just been the most exciting part for me, because you go through the process of making this content, editing it, and just seeing everything that we can do to get to the end result that at the end of the month. And then everyone can join. And instead of me holding it just to our members, we want to let this be an opening space for everyone. We want everyone to see what we can do, and then from there, trial our website and see if there's any other components that you want. And you always have access to this information. So we have live and home studies, continuing education. So if you're there, we give you live. But if you miss it or something came up, it's always going to be sitting in the membership for you to get home study CE as well. So that's the extra incentive for our pharmacists. We're working on getting it for physicians CME as well, nursing CME, nurse practitioner, PAs. We're going to try to get everyone a time to do that. So that's the biggest part we have right now, and it's what I get excited about at the end of every month. It's usually the last Wednesday of the month we have our live webinar, and it's just always a special time.
I love that you take requests. Again, you're listening to your users and what they want and need. Now, the live webinars or live seminars, do you open that up for the public to view at no charge, or is that all included in the monthly fee?
So for the public, again, you can join that webinar for free. I want you to be able to see what we have. And
Okay.
I want everyone to test out. And I do monthly subscriptions because I want to prove to the community every month that is worth it. I want to prove that something's valuable, and that's where it's a back and forth. Where if you want something and you have the responsibility to let me know what you want, and then from there, I have the responsibility to produce that information. And that's the one thing that, again, being at our size, being you know really niche down to what we do helps us quite a bit. So if you are interested, you watch a webinar first, and then if you want the handouts, again, we even give you the handouts for no charge, and then offer you to come do a trial, a 7-day trial for free. And then from there, you can figure out, is this the best program for you, and does this impact you and provide value to you? Because again, I just want to provide you value from what you know. And again, we try to give you confidence and competence as well.
What a lead magnet. I mean, really, just offering all that those free opportunities. That is amazing. The live webinars, live seminars, rather, offering the access for 7 days. That's awesome. But what if somebody says, "Yes, this is awesome. I want to buy into it." What are your prices?
Yeah, so we have a few ways that we can do this. So as of right now, for our every month for our members, it's going to be $45 a month. Again, that's just updated because we now I forgot to even mention we have a native app as well that's available for Android and Apple. So that was a recent request from our members that we just brought on. So $45 a month for us, and then from there, if things go south, again, the great thing is that you're dealing with me. So if there is anything we can do to help people out, we can. We always have specials going on, whether it's 25% off, 2 for 1 month. So again, we always have different specials that goes on, but our standard price is going to be $45 a month, which is a recent change. And then if you want to do it annual, we have it to where it's be $363 a month. I mean a year, I'm sorry. And then that encompasses not just your membership, but also all of your CE for the year as well. So again, you can get one CE per month, one new CE per month, and everything as we have in the past.
I'm trying to calculate in my head what is cheaper, doing the monthly or the yearly. Surely there's an incentive there, right?
Oh yeah. So
Yeah.
again, for you get a significant discount for
Right.
that component, and I calculated it before, but again, it's 20% off for the annual compared to the monthly.
I'm whipping out my calculator here. 45 times 12
Oh,
is
actually,
540.
it's more than that.
So to get it for 360, that's a significant discount.
Yeah.
Do you agree on that? Is my
Absolutely.
math right?
Absolutely. I calculated by 10, and it's like I was like it's
No patients were harmed in the calculation of this price.
I promise this wasn't my dosing of epinephrine or anything like that. So you have to forgive me.
It's okay. I know as pharmacists though, we got that perfectionist in us that we just can't shake. Like we really do care about keeping people
Yeah,
alive.
and it's 33% off if you go that way. So
Okay. All right. Very good. Well, is there anything else you'd like to share about how you use your voice as a teacher?
I think one thing I think people will have to realize as content creators is realize that you don't have to be perfect, and there's people out there to help you better your voice. I by no, I'm not the best speaker. I tell people this all the time. I try my best, but again, if you feel passionate about something, if you are motivated to do something, you can learn to speak better. You can learn to feel comfortable in front of the camera. You can get different equipment, things of that nature. But the thing that no one can take from you is the passion and the motivation you have towards doing something. And people can help you along the way. But they'll help you a lot more if you have that passion compared to if you're just a phenomenal speaker and you are a drain to be around.
Well said. Yes, you got to take your passions and your strengths and just be inspired to use it and just get started. Don't worry about it being perfect. Don't be afraid to ask for help and don't be afraid to share your ideas because as much as you think people are going to steal your ideas, you know what? There's they're not necessarily going to do it because they don't have your passion, your strengths, your personality. So just get started. And yeah, I love that advice. I totally agree.
Well, again, I'm super excited to be on the Pharmacist Voice, and I always thought to myself like the worst thing that I have, and I always thought it was my voice. And now it's like I have to do so much content, whether it's video, whether it's the podcast, and it's just unique to think. 10 years ago, you could never tell me that I would have a podcast and an online presence in this setting where I do a lot of talking.
Well, you're doing great. And I actually, my voice is kind of raspy today. I'm not always perfect, but here's the thing, done is better than perfect. And if you can't hear Jimmy's head shaking, I'm going to tell you, or nodding. He's saying yes, that right,
Yeah,
Jimmy? It
yeah,
doesn't have to be
yeah.
perfect. Done is better than perfect.
And that's something you just learn over time, and you never like your voice initially, and then you notice other people don't think about the things that you are so concerned about. So it's just a phenomenal process, and once you get going and you start checking things off, and people are not saying, oh my god, you sound horrible. No one says that. And once you get past that fear, and then you can really start figuring out ways to impact your patients, your colleagues, and really just build something that's bigger than the fear of your voice.
Right. Your content's going to be great because you're a pharmacist, and Jimmy, you're doing it right. You're you're getting the great content out there. You're curating it in a way that pharmacists, nurses, doctors want to hear it. You're attracting more clients. So you've got this traction and you know that the way that you're using your voice is working. And I just want everybody listening to be inspired by that. You can do that too. Just be inspired to use your passion, your strengths, and get out there, get started.
Yep, get it done.
Absolutely. Now, one last question I've got to ask. I know that you use your voice also as a pharmacist, a practicing pharmacist. Can you tell me a little bit about how much do you spend actually working as a pharmacist and how much time do you spend working on your business?
Perfect. So again, I am full time as an emergency medicine specialist, and I also work PRN as an emergency medicine pharmacist at Grady Health System in Atlanta. So I spend a significant amount of time doing that, and usually during my off time, I spend almost all of it for the most part on certain days of the week building content, creating content, and really a lot of it is just organizing the structure in the plan. A lot of it is spent doing it that way because again, with 30 people contributing to some fashion or form, at different times of the year. I don't have 30 people every month doing these things. It may be 5 or 10 in a certain month. There are the ones who are making my platforms special. So it's not just me when I think about all of this. I have an assistant as well that helps out with some things. So I spend a lot of time building this, but I focus more of my time outside of being a full time pharmacist, creating the plan and creating the vision of what we're going to do for now and months in advance.
It's very healthy that you know that you have gaps in what you can do and you're letting other people help and be part of the team. So it's a very healthy mindset. I just want to just give you a lot of kudos for that because everybody thinks they got to do it all themselves when they first get started, but it's a very healthy thing to delegate. And I see a lot of great stuff in what you're doing. And again, this episode is meant to inspire people to use their voices too. And I am inspired by how you are using your voice. So thank you for being on the podcast.
Thank you very much for inviting me. It's been a phenomenal experience.
Well, Dr. Jimmy Pruitt, thank you again for being here on the Pharmacist Voice podcast. You take care.
Thank you. You do the same.